to part 3 of rehabbing a acute knee sprain. This video is devoted to educationally and financially help you out of taking care of yourself. It also teaches you a great survival skill, which is also like a conscious building thing. The more you know about yourself and how to take care of these little nicks and knacks along the way of life, such as bruises, sprains, and higher degree sprains. It's just a great self-care survival skill. So I wanted to continue on and showing you guys how to take care of the knee. This is part 3. The current status is the swelling is minimizing to the point where I have minimal restriction. What does that mean? I could pretty much bend and extend my knee without any kind of sensations of swelling, or clicking. I don't have any confidence issues of standing on my legs. Either it's one-legged or basically bilateral. But I still have problems or discomfort in squatting and weight-bearing exercises. So I wanted to continue on and show you guys how to progress the exercise protocol to build those strengths that you had before the injury. So that's pretty much what it is. Once you get rid of the swelling, the next phase is, can you engage the muscles? Once you engage the muscles, you need to start teaching the knee to bend or flex and extend passively and actively without pain through its function, which is 0 degrees and about 135 degrees flexion. Once that is achieved, it's like you want to cover properties that these bones are built for, and then transfer them to activities of everyday living. We are mammals, so we should be able to put weight into our legs, single and bilateral, also lunge, jump, crawl, and that's the last phase of pretty much returning back to pre-injury status. Little anatomy, education, and understanding of the knee joint. Your knee joint only flexes and extends. That's pretty much what it's made out of. It has 4 bones. We have the femur, we have the tibia, we have the fibula, and then we also have a floating bone. The muscles that extend the knee are on top. The muscles that bend the knee are behind you. Your bones are also weight-bearing bones, so you have to not only teach them non-weight-bearing exercises, but weight-bearing exercises. You have 4 muscles that extend the knee. You have the vastus medialis, you have the vastus intermedialis, you have the vastus lateralis, and then you have the rectus femoris. The muscles that bend the knee are semimembranous, semitendinosus, and rectus femoris. Rectus femoris is the most lateral, semimembranous is the most medial. That's all the muscles that pretty much bend and extend the knee. So let's make those really strong, and that's what this video is pretty much going to be devoted on. I'm still going to continue the visual and continual education of how to manually treat the swelling. There's minimal in my knee joint currently, but just from continuing understanding what to do with the instrument of soft tissue mobilization in the healthcare, holistic, medicinal world. This is also called GRASTON or GUA SHUA. Whether it's a butter knife, you need to know how to use it. You could also use a butter knife, what I'm trying to say, from like a comedic standpoint. And learning to identify where the restriction due to the swelling. When you have swelling in a knee joint, it turns off the muscles. So from a protocol standpoint, and that's why it's so important to initially get the swelling on a joint. And this is one of the most beneficial techniques that's been kind of shown to be beneficial from a treatment standpoint, is using the instrument and rubbing out the swelling into the muscles. So then when you try to activate the muscles, the blood flow will take the swelling out of the body. So back to identifying the restriction. If you feel the swelling is restricting more superior, meaning the quads here, you're going to have to bend the knee and rub along the joint line, meaning around the patella, near the joint line laterally, and rub it towards your quad. And eventually you will have a restriction standpoint, so initially when I started doing this in part 1, it was right about here. As you guys could see, I'm getting greater range of motion actively and passively, but I still have a little bit of restriction. But my restriction is posterior, so that's more hamstring. But let's go back, let's continue with the quad. With the quad, you'll just flex it, rub it from lateral joint line, IT band, iliotibial band, into the quad, right in front, rub it down into it. How aggressively you press, you want to press enough where you feel, or you actually you'll start seeing a redness along the joint line. Rub it down, rub it down. Use your fingertips, and the more you spend time in any field, the more of a sensei you will become. You also should kind of start, this is really a conscious thing as well. The more you know about the way your body functions, it's almost like a meditative kind of conversation. So as you do this, you'll understand where your bone is, where your tissue is, and then also you could look at your other leg as a foundational standard. It's like, whoa, I don't have swelling here, but it's swelling here. So that means you could actually just try to rub that out and make both sides identical. So you'll go from medial, keep rubbing from the joint line while it's flexed, and rub it down into the tissues so it could get sucked into via blood flow out of the body. You can purchase these tools pretty much anywhere on the internet. They're not, if you don't want to spend the money financially, you can use a butter knife. Also make sure you're lubricating the skin via cocoa butter, coconut butter. Just something that could glide the tool across as you try to grab the swelling and return it back to the bloodstream. All right, so like I mentioned, my restriction is more hamstring. So with the hamstring, your leg has to be straighter, right, more extended, versus when you have restriction on a quad, you'll have to try to flex it. It just opens it up in a way where the technique of using the instrument is beneficial. I have tried to keep the leg straight. I go near the hamstring joint line laterally, and then I rub into my body, more medial, into the bloodstream, not toward the foot, toward me, or toward your glutes. That's a common issue, or the conversation, the debate. How do you rub the tissue? We always want to get it into the bloodstream. Your heart is here. It's not towards your foot. And then you're spending few minutes rubbing out. Very, very simple, like I mentioned. Very beneficial when you add the instrument use with the exercise protocol, and at the end you follow it up with a ice or a cold bath plunge for a few minutes to come on, like make the tissues really happy. Because when you have a knee sprain, what happens, something got outstretched, meaning the ligamentous tendon regions, and those are really tissues that don't like to be outstretched. Muscles like to be outstretched, not tendons and ligamentous regions, especially past that point of optimal stretch. So you're just spending, like I said, spending some time rubbing it with the tool. And that's it. And that begins the next phase. The next phase is doing exercises that are pain-free. They create the engagement of those muscles that surround the knee. When you have the swelling in the knee, anything that attaches near the knee joint line goes inactive. So we're just trying to engage the neuromuscular system once the swelling is out of the joint. The foundation, quad sets. When you're ambulating, your knee goes through a small phase of stability. There's a lot of flex and extend, but there's a phase where your knee needs to be stable. And it really reinforces the stability muscles, which force the knee straight, which are your quads. So these are just quad sets. Can I slide a towel underneath my knee? Can I push my knee into the towel? Engage the muscles for 5 seconds. 4, 3, 2, 1, and relax. It's not about aggression. It's about technique. It's about engaging the four quads here. Minimal to zero joint line pain. The further you get away from your injury. 2, 3, 4, 5, and relax. Careful how much you plantar flex. Try to keep your foot, ankle stable. Squeeze. Push the knee into the towel. 1, 2, 3, 4, 5. And relax. 10, 15, 20 repetitions. My idea is it's about not flying through this. It's really just foundations. Revisiting it. It's like mathematics. You want to occasionally just revisit your addition, making sure you're really good with that. It's the building block to mathematics. So if you're having issues with calculus, you might forget that 11 times 11 is 21. Squeeze. 1, 2, 3, 4, 5. Relax. Don't be aggressive. 1, 2, 3, 4, 5. This is just continuing that conversation about after using a tool, using the quad engagement and trying to make the knee joint stable or 0 degrees extension, neutral, sucking out that swelling, edema out of the joint line, making sure the muscles are engaging correctly. 1, 2, 3, 4, 5, and relax. Squeeze. 1, 2, 3, 4, 5, and relax. Like 15, 20 repetitions, and then you take the next. You just keep building the properties on with the exercises. So let's continue on with that. The next thing that one needs to do, my recommendation from exercise is building that stability and adding your hip into it. So now, when you're doing this exercise, can I keep my leg straight? Quad set. Try to raise it to the same level as the other leg. Hold it. 1, 2, 3, 4, 5. Lower and relax. Make sure you're not arching your back. So midline stabilization. Quad set. Leg raise. 1, 2, 3, 4, 5. Lower the leg. Relax these muscles. So it's like on switch, off switch. It's not how fast we do this. You're recovering from an injury, which I am also. This is like I mentioned. Technique versus aggression. Squeeze,
into the towel. Feel the muscles that you did with initially with the quad set. Raise it, midline stabilization. 1, 2, 3, 4, 5. Lower, relax. Imagine somebody's dropping coconuts on your tummy. You squeeze the quad, you raise it 45 degrees. This is what your leg does when it hits the ground. 2, 3, 4, 5. Lower, relax. 20 repetitions is my recommendation. 5 seconds squeeze or 5 second hold. 1, 2, 3, 4, 5. Lower, relax. Squeeze the quad, raise the leg. Here's the 5 seconds. 4, 3, 2, 1. Lower and relax. Squeeze the quad, raise 45 degrees. 2, 3, 4, 5. Lower the leg, relax. As you do more repetitions, like I mentioned, you're not arching your back. You're using your psoas muscles, your hip flexors, and teaching your quads to communicate with your hip flexors. Raise the leg, midline stabilization right here. 2, 3, 4, 5. Lower and passive. Quad set, leg raise. 2, 3, 4, 5. Lower and relax. Squeeze the quad. Raise. 2, 3, 4, 5. Lower and we're relaxing. Squeezing the quad, midline stabilization, hip flexor involvement. 2, 3, 4, 5. And passive. Stability, hip flexor involvement, and now it's going to be stability, glute involvement. The idea here is bend the bottom leg, stabilize that quad, raise the leg, back down. Make sure you're not arching your back. Quad set, leg raise, lower. Quad set, leg raise, lower. We're squeezing the quad, making sure our femur cane goes out to the side. You should kind of feel your butt with this one, and relax. Once again, you're doing quad set, building blocks, and involving other joints now, other muscular groups. No arching. Raise that leg and relax. 20 repetitions is my recommendation. Quad set, no arch. 2, 3, and relax. Quad set, and then once again, you're turning the muscles on and off in between repetitions. Quad set, raise, feel the glute, lower the leg, and passive. If you're having a hard time because of butt weakness, don't worry about how high you raise it. Just making sure you're able to get a quad set. If it's here, eventually your leg will get higher the more you build the lateral glute region here. So no arching, belly button in, midline stabilization, quad set, leg raise. 1, 2, 3, down, and passive. Belly button in, pelvic stability, no arching, no flexing. Nice and strong and quad set, feeling those quad muscles, leg raise, and down. And that's the second of the quad set emphasis. The third one is you're laying completely flat. You're making sure your feet are off the table. You're going to make sure you're not arching your back. So if you feel you have low back discomfort, that means you have extreme lordosis. So you might have to tuck the pelvis. Midline stabilization. Try to raise the leg off, or imagine somebody's trying to put something underneath your knee. Can I quad set, raise the knee off the table, back down? It's not how high you raise your foot, it's how high can I raise my knee without arching my back. Quad set, quad set. If you feel that's occurring, try to find that good neutral positioning. The goal here is more butt involvement, not low back involvement. Quad set, femur extension, butt activity, a little bit of hamstring involvement. Quad set, minimize the arch, try to raise the femur. And that's the 3 progressive quad set with involving other musculatures. Those are the recommendation I would emphasize, because it goes back to really we're mammals, so we're supposed to be on our feet. And when you have quad stability, when you're standing, other muscles are involved. So you're just building the communication and understanding, not weight bearing. So if this doesn't hurt, everything that you do on the table or not on your feet doesn't hurt, that means you could do the standing exercises next. So next standing exercise, that's my fan favorite from a knee injury standpoint, is using a band around your knee. Let me show you guys. I want to get the camera right for you guys. Sorry, I apologize. Okay. So you want to use a TheraBand. You could also use a pulley system with a few pounds. You put the vector pull around your knee. So pretty much all the fancy terms. You have the band that's around your knees. This is an exercise reinforcing good flex and extend through small angles, but teaching you through weight bearing and also teaching some foot knee mechanics. So you're going to stand in a staggered stance. You're going to back up to the point where you feel, like I mentioned, it's not, well, I haven't mentioned it, is you don't want to have too much pull in the band. So staggered stance, let the band bend your knee, and then you're going to push your heel down, and that's going to reinforce what you worked on the table by squeezing your quad. Let the band bend your knee, 85% of my weight right here, and then I push my heel down and I distribute my weight 50-50. So right now it's 85, 15, I'm on my toe, and then I push the heel down. I really feel the quad engaging. 5-second hold. Then I'll let the band flex my knee. I push the heel down. That's going to just magically, dynamically, organically, biomechanically affect, or it's going to pretty much engage your quad. So as you push the heel down, there's that communication between your ankle, your knee, while you're walking. You should have minimal to zero joint pain. This is not supposed to be an aggressive exercise. They're building back to getting you pain-free before the injury. Squeeze that quad, feel it. 4, 3, 2, 1. And bend the knee. Squeeze that quad. 1, 2, 3, 4, 5. And boom. Very, very simple. Okay. The next exercise is using the same kind of band technique.
and finding a box, 8 to 10 inches. The average step in Western architecture, or pretty much anywhere you're traveling in the Western Hemisphere, is 8 to 10 inches. So you want to start doing exercises that not only cause flex and extending of your knee, but transfer it toward everyday living. So this is just a really good one to do with the TheraBand again. You have the TheraBand, so if you could do the general terminal knee extensions in staggered position, you want to progress to this exercise. You would find that step, 8 to 10 inches. You're having your foot positioning on a step. So you're doing the same thing that you did last time by pushing the heel down, but now can I do the same thing and get myself reverse step up onto your box? So boom. I'm not trying to push off. I'm trying to use this quad to get up on the step. And then I'm going to let the band bend my knee, and I'm going to return. So it's like a weight distribution exercise via your recovering knee by strengthening those quads onto a box. Very simple. If you're having a hard time with the balance, use something for assistive standpoint. Use a stick, a foam roller. Build that confidence. But ideally, you should be able to do this 15, 20 repetitions, minimal pain, great exercise. Building those strengths, building that flexion, extension, joint line, confidence into the leg. Push that knee down, squeeze, hold it a few seconds, understand that single leg balance. Reverse step up via terminal knee extension. Feel the quad work. Feel how you're never totally still. Try to even out the weight distribution through the ankle while you have your quad set. Now can I let the band bend while you step down and build that flex and extending with a little bit of resistance. Great exercise. Next thing I want to go over with standing is your ability to stand on one leg as you're having a quad set. So you want to use something that is unlevel. So couch cushion, some towels. What else we could use? Stand on some grass if you don't have anything like that. In my case, I have an Eric's pad. We're going to try to keep the quad set. It's going to be you'll never be totally still. That's the purpose of this exercise, is like a little reaction exercise while you're trying to keep that quad set. 30 seconds. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 9, and 30. Eventually you want to progress to a minute for the video, and the length of the video I'm going to shorten it just for 30-second phases. I'm going to perform 3 sets. I like to alternate, and you should as well. You want to teach and you want to balance things out. So, and you also give a chance the recovery leg to break. So as you stand on this leg and balancing it out, you also will understand what this leg, the healthy leg versus the recovering leg. It's just a good standard to have. They should both feel the same way from like an exercise standpoint. Need quad set, figure out the weight distribution, level pelvis, emphasis. You'll never be totally still. Earth's spinning, you're breathing, heart's pounding, so there's always a vibration about you. It's also a great calf ankle stabilizer exercise, so you will develop good ankle and calf strength, which is also a stabilizer at the knee joint. The stronger the calves, the more support the knee stability. Back to the injured leg, quad set, figure out the weight distribution, level pelvis, 30-second emphasis in this video, but eventually you want to progress to 45 to a minute, adding tossing exercises, whatever the case may be. The goal is finding something on level, and your ability to stand on one leg is a very impactful skill as you get older, and also a skill that you need to acquire after an injury. It builds confidence, it really exposes the action, reaction, and twisting. And if you're having an issue with this, it's a really, it could pretty much let you know whether you need to progress or degress. Can I stand on something on level, single leg, and stand the time frame is a skill not only for survival as you get older, past the age of 45. Your ability to stand on one leg is one of those skills that lead you toward an early grave, or you have a nice sunset. So what they've noticed is anybody who has a 45 has an inability to stand on one leg, you have a higher chance of early mortality, meaning you slip and fall because you can't stand on one leg and understand the weight distribution, the motions of life, and then you have a big injury. That big injury causes a sedentary lifestyle. You psychologically, biomechanically don't move. You develop bad vices, overeating and not moving. Also adding other kind of vices like alcohol or addiction to pain meds because of the severity of the injury. So it's a domino effect, snowball effect. If you can't stand one leg, it's a bad issue. If you can't stand on one leg after an injury. So as simple as, and it looks simple, but if your inability to perform it, you really get exposed how weak you are. This is the building block to life, stability, and reacting to stability on one leg. My opinion. 30 seconds, 3 rounds. Very simple. Very, very simple, guys. Once you really acquire those properties I'm showing you, the strengths about the knee, which is squatting correctly. So that's the last phase, and plyometrics, so meaning the ability to jump bilaterally in single leg, is pretty much the 4th phase of the recovery. I will show you guys that in the next video. But from a topper, before we close off here, your hamstring eccentrics and quad eccentrics are very important in building those strengths so you could squat and do the plyometrics. My 2 fan favorites with hamstring eccentrics are doing a Swiss ball on the floor and doing slant board eccentrics for your quads. With the hamstrings eccentrics on the floor, we're going to need a ball. And then with the ball, you're going to set yourself up on the floor. I'm going to get the camera right for you guys. Apologize. Hamstring eccentrics. So the setup here is using the ball, getting yourself on your back. So once you're on your back, you want to put your knees
in a 90-degree bend. Okay? Heels on the ball. You're gonna lift your hips up. That's gonna get the glutes going. And then you're gonna slowly extend the knees while your toes point up. Once you feel your quads engage, your knees are straight, you just lower the hips. Very simple. So, about a 90-degree setup. Heels on the ball. You raise the hips, feel the glutes. Then you go 3, 2, 1. Nice and slow. Lower the hips and relax. About 15 repetitions. And the key word here is eccentrics, meaning the slowness out, extending the knee. That's going to really strengthen the hamstrings for squatting, plyometric work, lunging, jumping. It's a really clever technique, sending direct blood flow to those muscles, because those muscles shut off when you have a knee injury, because they attach near your joint line of your knee. So this has just been shown to be a great protocol, getting back to a healthy, strong, pain-free knee. So slowing this out, 3, 2, 1. Make sure you also don't arch. As you have any kind of weakness and as you get tired, you may arch your low back, or you might flex it too much. Make sure you're engaging transverse abdominis, so belly button in. Don't hold your breath. Raise the hips. Feel those glutes. 3, 2, 1. Squeeze the quads. Nice and slow down. And being passive. Set yourself up. Don't worry about how close it gets to your chest. Just right about 90 degrees. Heels on the ball. Raise those hips. Slow. 3, 2, 1. Hips down. Bring the knees to starting position. No arching. Blood engagement. 3, 2, 1. Nice and slow down and passive. Starting position. Hips level. Minimal arch. Belly button engagement. Ribs down. Hips up. Butt engagement. 3, 2, 1. Hips down. Knees 90-90. Ribs down. Transverse abdominis. Hips level. Minimal arching. Hips up. Butt engagement. 3, 2, 1. Hips down. And relax. Fantastic exercise. And the technique is the eccentric part. It builds that strength in bending, extending the knee. Once you're finished with the hamstrings, eccentrics, the next really good one is the quad eccentrics. And the fan favorite that everybody's performing on the internet, and it's been shown to work, are slant board eccentrics. So the goal is getting 45 degrees on a slant board. This is my self-made slant board. You could go out and spend $100, or you could just recreate the 45-degree slant. One thing from like educational standpoint, the exercise world produces billions and billions of dollars, but are we fit? Technically more fit in non-worlds or non-countries that don't force fitness levels. So there's a lot of reinforcement to buy all these products, but if you can recreate it yourself, power to you. And that's why I really started this channel, is to make sure everybody knows how to self-care without spending finances left and right, going to doctors and chiros. You should know some of these basic skills of self-care. So back to the quad eccentrics. The goal, 45-degree slant. You put your heels on that slant board. That just puts you in a position where the quads are going to be isolated and going to be forced to work. And your goal is to push the knees forward and go slow and feel the lengthening. It's not how deep you go, it's the slowness down, feeling that length, and then coming back up. You want to go about 3 to 5 seconds. Eventually your depth will, your range will increase, your ability to get lower, but the checklist is making sure, can I go slow down, build properties of lengthening, which are foundations to strength, without having any joint pain. As you have minimal joint pain, and your ability to go slow down gets larger. So eventually you'll see people, and your ability to get to your heels to your butt, or your butt to your heels, should be accomplished, but not at the expense of any joint pain. In this case, going slow down, 3, 2, 1, and then come back up. No arch in your low back. Just push those knees forward. Go nice and slow. 3, 2, 1, and then come back up. A few seconds rest in between. 3, 2, 1. Initially you might have pain, but that's okay. As long as the pain is minimal, 3 out of 10, maybe 4 out of 10. And as you perform this, your pain should minimize. You'll build greater range. You'll feel muscles engaging correctly. And then through time, your depth will become larger. Pelvis level, flexion while you're weight bearing, strengthening quads, teaching knee, ankle, hip flexion. That's what happens in moving and performance or just ambulating activities, everyday life. You have ankle flexion, knee flexion, and hip flexion. But in this case, we're adding a component of really making sure, can I feel my quads while my range gets larger. 20 repetitions is my recommendation. But if you need to break it up in two sets of 10, but eventually you want to get to about, can I complete 20 repetitions slowly without pain. I want to thank everybody for watching the video. Please like, share, and subscribe if you haven't. Look out for part 4, which is the last phase of treating an acute knee sprain, which is going to be more of a corrective squat, plyometric reinforcement, and building larger forces into these bones and into this joint line. I hope you liked the video. Please like I mentioned, please do a thumbs up for me. Like, share, subscribe. Check out my Patreon as well as my Instagram. Everything's in the comment section. Please have a great recovery and look out for part 4.